to your home care video for the DF2 Brace. My name is Maureen Hoff. I am the Director of Parent and Patient Advocacy for Orthopediatric Specialty Bracing, and just a fellow parent who has had to utilize a brace at home with their child with an orthopedic condition. So while your child is wearing the DF2 at home, there will be some adjustments that are needed for your day-to-day care routine. This video is really going to go over a few really important reminders for the medical care, but also give you some helpful tips from other parents whose kids have used the DF2 brace. The DF2 brace is intended for femur fracture fixation and post-operative stabilization in pediatric patients from approximately 6 months of age to 5 years of age by providing the immobilization of the femur, knee, and hip. Let's start by going over the different components of the DF2. So the sock is always used when the brace is on your child. It's designed to prevent skin irritation or any skin sores. You're going to want to talk to your provider about when, if, and how you can remove this sock for cleaning. Next is the pelvic girdle. This holds the pelvis with the plastic and foam band. The hook and loop strap is used to anchor the brace in the correct position throughout the course of treatment. The hip hinge maintains that fracture position and allows the treating provider to make the necessary adjustments to the bones as needed, whether that be flexion, extension, adduction, or abduction. This hinge can be locked and unlocked by the provider, but it isn't anything that you are going to want to adjust or even mess with yourself at home. Next is the outer sleeve. This covers the thigh and leg while immobilizing the knee that's at that preset angle. The thigh tongue covers the front portion of the thigh and sits inside that outer sleeve. Similarly, the calf tongue covers the front portion of the calf and sits inside the outer sleeve. The foot plate helps protect the foot and prevents rotation of your child's leg. It is removable, but you're going to want to check with your provider about when and if it should be removed throughout the course of your child's individual treatment. All right, now let's go over the medical care related items to your DF2 with some important reminders related to your child's treatment. So first, do not remove the DF2 without the consent of your care provider. Whether your child is in the DF2 for fracture healing or post-operatively, it's important that you've discussed when and if it is appropriate to remove the DF2 at any point in their wear. This is especially important when utilizing a brace rather than a cast. There is more responsibility and ability to remove the brace for cleaning or such of that nature, but you are really going to want to make sure that you are talking to your provider before you do that. Treatment time can vary depending on each child. So if you have questions about how long your child will be in the brace, ask your provider for a general timeline of that treatment. One of the benefits of the DF2 versus the spica cast is that it can be adjusted to accommodate the change in swelling in your child's thigh. So if there is an injury to that thigh, there is a natural swelling that will happen to help your child heal. This brace will allow you to make adjustments to ensure the proper healing in the way that a cast won't. If you believe that there are any further adjustments that need to be made to the DF2 outside of just the general tightening of the straps, please contact your medical team before doing so. Let's talk about cleaning the brace. While your child is in the brace, it can be cleaned with a washcloth and warm water. It can also be disinfected with rubbing alcohol or mild antibacterial wipes if necessary. You just want to be careful that you're not using anything that will irritate your child's skin. That's another reason why we want to ensure that the sock is always utilized between your child's skin and the brace. You do not want to submerge the DF2 brace in water or any sort of cleaning liquids. So if you have been instructed by your provider that you are able to remove the device for baths or anything like that, you want to ensure that you're not putting it fully in some sort of cleaning solution. We never recommend any harsh cleaners or bleach wipes because that will be in close contact with the skin if you're using it on the brace. If you're able to remove the brace fully, you want to make sure that the brace is completely dry before it goes back on your child. So do not put the DF2 brace in any sort of mechanical dryer. It needs to air dry only. Let's talk about cleaning the socks. Obviously, the socks are going to get dirty because your child is going to be wearing it underneath the brace at all times. It may be tempting to remove the brace to change the sock, but you're always, again, going to want to partner with your medical team before making any sort of sock changes. The socks are machine washable. If the socks that you are using have been provided with the DF2, the washing instructions are located on the back cardboard insert of the bag. Instructions will include machine wash warm, tumble dry medium, and do not use any bleach. If your child is mobile, walking or running, those activities will need to be suspended to allow for proper healing. The fracture is still really fragile right after injury, and so you're going to want to avoid any weight-bearing activities. That includes standing, pulling to stand, assisted or unassisted. It will help that your child will naturally limit their activities that cause them pain. So you shouldn't have to battle too much with them during this time frame because they will be avoiding things that cause discomfort. You should also be careful to avoid any activities that could cause a fall. That could be being pulled on a bicycle, using playground equipment, climbing on furniture, or roughhousing with those siblings. If there's any potential of falling from even a bed or a couch, parent supervision is recommended. Some parents find it really helpful to utilize a stroller even within the house because their child is naturally secure and they are able to move around without having to have that parent supervision. Let's talk about diapering and toileting in the DF2. When removing and putting on a diaper, it can be accomplished in the normal fashion, except that you're gonna wanna avoid lifting the lower back in the air, as that could be uncomfortable for your child. To avoid this, it can be easier to change diapers on a soft surface, like a mattress, where you can push down into that soft surface to remove the diaper and then slide the new diaper up and behind the lower back. This soft surface will help facilitate diaper changes without lifting your child's upper legs and lower back into the air. You'll also want to make sure to secure the diaper in between the leg and that metal hip joint. When your child is using the toilet, the brace leg will need to be held in the air. This is usually done by a parent or caregiver and is to prevent any sort of discomfort that gravity would be pulling the leg down. That's why some parents use a training toilet as a good option because the leg will naturally be supported by the ground. If your child is utilizing pull-ups, it can be easier to switch to a traditional diaper, which has those Velcro straps, and it avoids having to pull up over the legs. So what kind of clothing do we recommend your child wear with the DF2? So we always suggest baggy pants, like jogging pants or sweatpants. These could even include those athletic pants, old school, that have the snaps on the sides. They work really well to go over the brace. But if you can't find those, it's recommended to buy at least 1 to 2 sizes larger than your child's current size to accommodate for the brace. Any shirt or sweatshirt that's not too tight works well to go over the top of the waist section. A lot of parents have had success utilizing a onesie style shirt with the snaps that go underneath their child. This will help prevent any sort of bunching up under that waist section. If your child is older, there are larger onesie sizes that can be found online if you do not have them. Anytime you're trying to put pants on your child's leg, make sure to start with the pant leg on the uninvolved side first. You're gonna wanna pull the pant up, covering the leg below the knee, but not pulling all the way up. Then you're gonna move to the injured leg with the brace. You're gonna feed the leg with the brace on it through the pant leg to that same location that you did underneath the knee. Now you can pull the pants all the way up. This will prevent any sort of discomfort with snagging or catching as you are putting those pants on. If your child is no longer using one of those portable car seats that you're clipping into your car and taking out, the best way to move your child around while in the DF2 is either in a wagon or a stroller. Adding blankets, pillows, other support items, and fun things like toys can make your child more comfortable while in that wagon or stroller. Many families have even utilized a stroller inside the home or their daycare environment to transport their child safely and have a good landing place for them to keep all of their stuff. While a jogging type of stroller that has a wider base can be really utilized at your home, sometimes umbrella strollers are easier to utilize outside of the home and in that daycare environment. Using a baby carrier that you wear on your body is discouraged while your child is in the DF2 because we want to prevent any potential falls. It's important to remember to be gentle with your child and yourself as you all adjust to the DF2 during those first couple days. As with any change, especially a medical change, it will take a couple of days for you all to figure out what those necessary accommodations are to help you adjust to the brace for the remainder of that treatment. Take comfort in the fact that you are on your way to helping your child heal properly. As many families have reported that even after their child has discontinued the use of the DF2, they are requesting to bring them home with them. The brace becomes really a companion for your child as they heal. It's a source of comfort because it is providing them with pain relief during that healing process. And remember that your medical team is here to help. If you have any questions or concerns along the way, please don't hesitate to reach out to them.